Patients are asking, when they are told their eye needs to be stable for a period of time before they can have LASIK, what's all that mean? Let's talk about a couple of scientific things. Astigmatism doesn't change. That part of it is your cornea out of round from the time you were born. So whether you are 10 years old or 50 years old, the astigmatism, for the most part, is pretty much the same. It's the outer round of the cornea. How someone is measuring it can change. In other words, there can be measurement error as well. Stability of prescription really is dependent upon the spherical part, or whether you're nearsighted or farsighted. That changes mainly when you're getting taller. And as you get taller, the eye gets longer. Well, most people, stop getting taller by about 18, give or take, which is why the American Academy of Ophthalmology recommends 18 and up for LASIK. Could it change in ways other after that? There is some thought that a lot of reading up close can still stretch the thin scleral coat of the cornea, maybe in the late teens, maybe early 20s a little bit, but not much further than that. And that's pretty uncommon. Otherwise, if your prescription is changing, after that, even in your mid-20s, you've got a problem. Because the only thing that changes your prescription has to do with disease problems, whether it's diabetes or keratoconus or something else causing the actual cornea to change. And that is something that's not very common. So in reality, most people's prescriptions are pretty stable. The problem is you could have one measurement and another measurement, and there's error in measurement. And you could say, when there's error in measurement, you can even say, oh, it's changing, when it really hasn't. But that is something most patients really achieve stability. We've done a lot of people at 18, 19 years old. That's it. They're done. We don't see them again. And it doesn't keep changing. And so we really do, for the majority of people that don't have other disease problems or rare problems, really achieve stability pretty much by the end of their teens.